All right, let's dive in. Today, we're going to tackle a form that honestly might look a little intimidating at first, but it's actually the backbone of our entire national healthcare system. It's the HR data collection form, and getting it right is absolutely crucial. So we're going to go through it step by step and make it super simple and clear. Let's get to it.
So, first things first, why should you even care about this form? I mean, it's easy to look at this and think, great, more paperwork, right? But the numbers you enter here have huge real-world consequences. They literally help determine where doctors are sent, which hospitals get more resources, and how we plan for the future of healthcare in this country.
Exactly. Because once you really understand the why behind it, the how becomes so much easier. This isn't just about filling out a spreadsheet. It's about people and making sure patients get the care they need.
Okay, so here's the official purpose. But what does that actually mean? Well, think of it like this. The Ministry of Health is using your data to build a live map of our healthcare workforce. Your input helps them see where the gaps are, decide where new staff should go, and even rethink entire job categories. The numbers you enter today genuinely shape the policies of tomorrow. Okay, so before you type a single number, let's go over a few ground rules. Trust me, getting these right from the get-go is going to save you a ton of headaches later on. And here they are, the 4 golden rules. First up, and this one's non-negotiable, all your data has to be a snapshot from one specific day, June 30th, 2025. Not the 29th, not July 1st. Got it? Cool. Second, no decimals, no fractions, just good old whole numbers. Third, and this is a big one where people trip up, if a category has 0 staff, don't just leave it blank. You have to actually type in a 0. And last but not least, see that little star? That means it's mandatory. You can't skip it. Simple as that.
Okay, one more key definition you're going to see over and over is this no pay leave column. So what is it? It's for any staff member who's on leave without pay but is still officially on your books. The really important thing to remember here, this does not include maternity leave. So anyone on maternity leave, you don't count them in this specific column. All right, rules are out of the way. Let's get our hands dirty and start with the general information. This is the easy part, kind of like the warm-up.
This is really just the basic stuff about your hospital. You'll see drop-down menus for most of it, so just pick your institution's name, its category, like if you're a national hospital or a base hospital type A, and of course where you're located. The 2 numbers you'll need to type in are your total bed strength and then your bed occupancy rate. Just having this info helps create that complete picture of what your hospital is dealing with day to day.
Okay, warm-up's over. Now we get to the real meat of the form, the staff cadre data. This is where you'll break down your entire workforce, position by position.
You're going to get very familiar with these 5 columns, so let's walk through them. First, last approved cadre, that's just your official approved number of positions. Then you've got in position. That's how many people are actually in those jobs on that key date, June 30th. Next is cadre requirement. This is the ideal number, what you should have based on the norms. Then we have justification. And this box is super important. It's your chance to explain any big gaps or differences. And finally, there it is again, that no pay leave column we just talked about.
And here's the best part. Once you get the hang of that 5-column layout, you've basically cracked the code for the whole form. Seriously, that same structure just repeats over and over again for every department, whether you're talking about admins, support staff, or your technical teams. It's all about that consistency.
But you know, a hospital isn't just one big block. It's made up of tons of different wards and units, right? Well, the form is built to handle that.
Which leads to a really common question. How in the world do you report separate data for the medical ward and the surgical ward and the OPD and everything else? The answer, thankfully, is super simple. You'll see a little plus button, that's your magic button. Every time you need to add another ward or unit, you just click it and bam, a whole new clean section pops up, ready for you to fill in. Now, when you're doing this, please be thorough. We need to capture the entire picture of your hospital. I'm talking every single ward and unit. Your main wards, like medical and surgical, of course, but also your special wards, like the OPD, the ICU. And don't forget the subspecialties, like orthopedics or the eye clinic. Every single entry makes that national healthcare map we talked about more precise and way more useful. Okay, so you've plugged in all your numbers, you've added all your wards, you are on the home stretch. This last part is all about double-checking your work and making sure it gets submitted successfully. Before you click that final button, just take a minute, literally 60 seconds, and run through this quick checklist in your head. Did I fill out all the starred fields?
Did I remember to add every single ward? Is that no pay leave column filled out right? Just a quick look over now can save you a whole lot of back and forth later.
And hey, don't stress about your internet connection cutting out and losing all your hard work. The platform they're using, Kobo Toolbox, is pretty smart. As long as you're online, it's automatically saving and uploading your progress every 5 minutes. So you can just focus on getting the data right.
And if you do get stuck on something, you're not on your own. There's a whole team of senior registrars ready to help you out. Here are their names and contact numbers. Seriously, if you're unsure about anything, just give them a call. That's what they're there for. And really, that's it. You are totally equipped to handle this form now. Just remember, as you're filling it out, you're not just punching in numbers. You are literally telling a story, a national story about our healthcare workforce, what we need and where we're going. Which really leaves us with one final big question. What kind of story will all of our data tell when we put it together? Thanks so much for tuning in.